More coverage on the healthcare crisis from the Target 12 investigators. The Hospital Association of Rhode Island says Governor Dan McKee's proposed cuts in the upcoming budget could worsen a shortage of primary care doctors.
Target 12 investigator Alexandra Leslie joins us now with a preview.
Leaders of the hospital trade group argue that Rhode Island leaders need to address the root cause of the healthcare crisis. The interim president tells me that comes down to one thing: Medicaid reimbursements. As part of his plan to balance the next state budget, Governor Dan McKee is asking lawmakers to limit increases in the rates the state Medicaid program pays providers. The Hospital Association of Rhode Island argues that's the wrong solution.
We're finding that, and very clear on the primary care side, that payments are less than the cost of providing care, so it makes it difficult.
The association's interim president, Howard Delude, says payments by commercial insurance companies are also coming up short compared to neighboring states like Massachusetts and Connecticut.
Somebody can go over the line and make more money, or they can take the train up to Boston and make more money, or you can, if you're in South County, you can go over the line into Connecticut and be paid better.
The governor notes he had to close a budget deficit estimated at roughly $250 million, and that required difficult decisions.
I think that we've pretty much expanded everything that we can do in the healthcare area in this budget that's proposed.
McKee's office says the hospitals are still poised to get a net increase of $11 million under his budget plan. But Delude says the Hospital Association is working with state lawmakers on proposals they say could bring in more matching federal dollars.
Another proposal that would say we should increase some of the payments to hospitals and other types of contracts by a little bit, so there would be an impact on the commercial insurance side. But all of that together could generate close to $400 million in additional payments. Obviously, the state has some budget difficulties to deal with. I think the question is, can you afford not to do something like this?
All of this comes amid significant uncertainty about future federal funding for Medicaid. The blueprint approved by the U.S. House this week could lead to hundreds of billions of dollars in cuts to the program. I'm Alexandra Leslie, 12 News.